Hi everyone, and welcome to tonight's webinar. I'm going to be presenting for about 30 minutes and then we'll have 30 minutes for questions. If you want to write your questions in the chat, I will then read them out at the end and answer accordingly. If we don't answer all the questions in time, then we're going to be taking note of the questions and write a blog afterwards so everything gets covered. So I'm Yasmin. I am the fertility advisor team lead here at Fertility. I have been a nurse for 10 years and a midwife for 7 years, and I've always worked in women's health. I sidestepped into fertility and worked in a private fertility clinic for 2.5 years, and then I joined Fertility 3 years ago. So I'm excited to dive into a topic that affects every single person here today, regardless of age or gender, and that is optimizing hormonal health. So we're going to cover a few different things today. We're going to get to know your hormones a little bit. We're going to understand what exactly is a menstrual cycle and what are those cycling hormones doing and how are they affecting you. We will also look at some hormonal do's and don'ts, so some top tips to maintain hormonal balance. We'll talk through some signs to be on the lookout for that might suggest an imbalance, and I'll chat a little bit about why testing your hormones can be beneficial. At the end of the session, the hope is that you'll understand the role of your hormones in your health and well-being. You'll learn the importance of cycling and symptom tracking, and you'll find out how to make your hormones work for you. So the first thing we're going to need to know is, if we're going to understand our hormones, is what exactly is a hormone. A hormone is a chemical that's produced in one part of the body, then travels through your blood to another part of your body to tell it to carry out a function. So hormones are basically your body's way of communicating. Your brain, for example, uses some of the hormones that it produces to travel to the ovaries to tell the ovaries what to do. But it's not just the menstrual cycle that communicates this way. Everything you do is regulated by hormones. That includes how much you grow, your mood, your emotions, your sleep. Your hormones will tell you when you're hungry, they'll tell you when you're full. They are essential and you cannot function without them. Now, the levels of each hormone will change depending on its function. If a hormone's role is to tell you you're hungry by making your stomach grumble, the amount of that hormone will then drop when you start eating again. And in the context of women's health, your hormones will change both over the course of the month and over the course of your lifetime. They'll begin to rise during puberty. Some of them will drop dramatically and others will rise dramatically during pregnancy. And then we'll see a general decline of reproductive hormones as we approach menopause. So part one, understanding the menstrual cycle. I just want to make sure that does someone mind just doing a thumbs up in the chat just to make sure you can all hear me and everything's okay? Okay, no one's replied, but that's fine. I'm just going to hope that everyone's fine and everyone can hear me and see me okay. So part one, understanding the menstrual cycle. There's a lot of talk about the menstrual cycle in females being a vital sign. And if you're not sure what I mean by that, our vital signs reflect critical aspects of our health. So we've got temperature, pulse rate, blood pressure, and respiratory rate, which is something that is tested, as we all know, if you're unwell or you're at the doctor. But now they'd also want to add the menstrual cycle as a fifth vital sign, which shows how profound and important it is and the effect that it has. I know that ever since I started tracking my cycle, I pretty much blame everything on my cycle. And I've got to know my symptoms so that when I'm experiencing a certain symptom, I know where I am in my cycle. The American College of Obstetrics and Gynecologists has said that they consider the menstrual cycle to be a fifth vital sign in women, so an essential measure of a woman's overall well-being. And what they're saying here is that if someone isn't experiencing a normal menstrual cycle, there might be something going on with their health that we should be looking into. But what is the menstrual cycle? The menstrual cycle is a recurring cycle of physiological changes in the uterus and ovaries, accompanied by hormone level changes throughout. Now, everyone has probably seen this diagram before in textbooks from school. This shows a 28-day cycle with ovulation happening on day 14. In practice, only about 13% of women will actually have a 28-day cycle, and about 10% of those women who have a 28-day cycle will ovulate on day 14. So, if this picture here doesn't sound like your experience, don't worry. You're not alone, you're actually in the majority. But this is just a useful example to understand the basics. And then we'll talk a bit later about what falls under expected cycle lengths and then when things might need to be looked at by a healthcare professional. So over the next few slides, I'm going to talk you through the different phases. You can see them here, and then the different hormones that are involved in this process. The first phase is menstruation, i.e. your period. Day one of a new cycle is the first day of your period. What's happening here is that the uterus lining is shed and this manifests as bleeding, usually for about 2 to 7 days. Depending on the day, this blood can range in colour from dark brownish black to bright red and usually dark brownish red again at the end. It's also not just blood, there's also tissue and mucus in there and sometimes blood clots. Blood clots are normal, but if they're bigger than a 10p piece coin, then you should speak to a healthcare professional. And during this time, you might experience cramps and discomfort. You might be tired, have low energy levels. So try taking this into consideration when you're planning day-to-day life so you have time for extra sleep and rest if needed. And at this time, your hormones should all be at their lowest point in the cycle, which you can see at the beginning of the diagram. They've just been reset to their baseline, so there's not an awful lot of hormonal spikes at this time. The follicular phase. So menstruation is occurring in your uterus, then in your ovaries, the first half of your cycle is known as the follicular phase. And this is because you're growing follicles, which are fluid-filled sacs that contain your eggs. So menstruation and the follicular phase both start on day one. Menstruation is encompassed in the follicular phase, and the follicular phase will then last usually between 10 and 22 days, but its length can vary from person to person and even from cycle to cycle in the same person. During this phase, your ovaries are preparing for a mature egg to be released. And just like in males, where it takes about 3 months to fully mature sperm, it takes about the same for eggs as well. So again, that really highlights the recommendation of introducing healthy habits about 3 months before you want to start trying for a family. Females are born with all the eggs they're ever going to have, and they spend most of their time at rest until they're recruited. And about 1,000 eggs are recruited at a time, which sounds like a lot, but we have thousands and thousands and thousands of eggs in our reserve. And over the next few weeks and months, many of that 1,000, unfortunately, won't be strong enough to continue growing and will die. That's just how it works. By the beginning of this said follicular phase, only a few will be strong enough to make it to that last leg of the race. You might have 10 to 20 left at this point. That could also be less and it could also be more. And about a week before you ovulate, so maybe around day 7-ish of your cycle, one of them is picked out as the strongest or the dominant follicle, and the rest again will die. That's just how it works. In some cases, you might have more than one dominant follicle and they both might go on to ovulate, which if you became pregnant in that cycle could result in non-identical twins. But for the most part, there will only be one dominant follicle. And it's this very appropriately named follicle stimulating hormone, or FSH, that is acting on these follicles, stimulating them to grow and mature so that they are ready for ovulation. That's what's going on in the ovaries. And then, in order to prepare the environment, so the uterus, and set the stage for ovulation, we'll also begin to see a rise in estrogen, which has many functions, but one of them is to thicken your lining in your uterus, your endometrium. And your estrogen is like your superwoman hormone. So, estrogen makes us feel great. We feel more optimistic, we have more energy, our skin and hair feels great, and we should have an increase in libido. And it's all because estrogen continues to rise the closer we get to ovulation. Then we have ovulation. So this marks the day your egg is released from the ovary. It usually is somewhere around the midpoint of the cycle. But if you are trying to track it more accurately, you can use an app such as the Fertility app. You can check for changes in your discharge. It should become thicker and more egg white-like. Any personal symptoms you might have. And you can also then use ovulation sticks or temperature to help you out. Estrogen is high here, and we also see a surge of the hormone luteinizing hormone, or LH, which is here, the red one that doesn't do much and then suddenly peaks. And that causes the fluid-filled sac, the follicle containing the egg, to burst and sending it into the fallopian tube where it might be fertilized by a waiting sperm cell into an embryo. Now, when you're tracking your ovulation and you use the ovulation sticks that people pee on, that you are very common, it's the stick is testing for LH. It's important here to point out the fertile window and what I mean by that. So, the window during the cycle that you can get pregnant, because after ovulation, that egg has to be fertilized within 24 hours or it won't survive. So, you have up to 24 hours after ovulation, but actually, sperm can live inside the female body for up to 5 days. So, you have 5 days before ovulation and 1 day after, and that's called the fertile window. So in this textbook 28-day cycle, they're saying ovulation happens on day 14. I personally would say, because we expect ovulation to vary, that in a 28-day cycle, I would say ovulation can occur between sort of day 12 to 16-ish. So to start having unprotected intercourse from about day 10 of your cycle, or avoiding it in that time, depending on if you want to get pregnant or not. You'll continue to feel good during this time. You might have a little confidence boost. You'll continue having increased libido while these hormones are high. So, yes, a great time if you're actively trying to get pregnant to try. Then we have the luteal phase. So, the last phase is luteal phase. This starts from ovulation. And if pregnancy doesn't happen, as is the case most months in your life, it ends when your next period comes. So that fluid-filled sac that contained the egg has burst, the egg is gone, but the structure that remains in the ovaries starts to produce another hormone called progesterone. And progesterone begins to prepare the uterine lining for a fertilized embryo. So even though it will take sperm only about 30 minutes to travel through the vagina, the cervix, the uterus, and onto the end of the fallopian tube where it meets the egg, if it's fertilized, the embryo is much larger than a sperm cell. So it will actually take about 5 to 8 days to then travel back down the tube into the uterus. So that progesterone increasing has about 5 to 8 days to really create that perfect environment, which is essentially a thick and juicy endometrium with a great blood flow. If pregnancy occurs, the now implanted embryo will begin to produce its own hormones, which will travel back to the ovaries and tell them to continue producing the progesterone, which is essential to maintaining the early stages of a pregnancy. So, instinctively, the body is just extremely smart. But most months, most cycles, this isn't what happens. And without those pregnancy hormones telling the ovaries to produce progesterone, it can only produce it for about 2 weeks. And then the levels of progesterone will drop dramatically, which causes the uterine lining to shed, marking the beginning of a new cycle, and you'd be back to menstruation again. So during the luteal phase, and particularly towards the end of the phase when the hormone levels begin to drop, we don't feel great. As we have probably all experienced. This is when we start to feel PMS symptoms, so feeling tired, low mood, mood swings, cravings, oily skin and hair, and just generally that not fun stuff. So that's the menstrual cycle in a nutshell. There are different things that will then affect these hormones. Some of these things are things we have some control over, like the amount we exercise or our diet and nutrition, and some things will be out of our control. But we can still make choices to lessen their impact, like reproductive health conditions. Some of the things that affect our hormones will be obvious, like smoking, alcohol, and stress. Exercise is an interesting one. Exercise is great, but if you exercise a lot or maybe over exercise, you need the right nutrition for your body to maintain itself. So, athletes in particular, or if you're training for a big event, um, it can actually stop your period because you're overexerting your body. So, it's important to make sure you're fueling your body to maintain that energy output, or it then can create havoc with the hormones and cause irregular cycles or no period at all. Because we know the typical pattern our hormones will follow, we know how different hormones affect us, and we know how they might affect our activities day to day, we can really make them work for us. So we can predict what days we might be more productive, we can predict days that we might have a lower mood and prepare to be kinder to ourselves. We can let our partners know when they might need to be a bit more patient with us, and what days will benefit the most from an extra hour of sleep. But sometimes our hormones don't behave in the way we expect them to, and we can experience hormonal imbalance or out of range hormones. When we talk about a hormonal imbalance, there are things to look out for. One of them is, how do you look? Are you experiencing hair loss or changes in your weight that can't be explained by your diet or exercise? There would be a consideration here to look at your thyroid, or is PMOS, which was formerly known as PCOS, are they a possibility? Are you experiencing new or persistent acne, for example? Maybe your testosterone is acting up. And these are all things that at Fertility we can help with. How do you feel? Does your mood change a lot? Are you irritable or tired all the time? Maybe you have a good sleep hygiene, but you just can't shake that exhaustion. Are you always too hot or too cold? Again, this might mean your thyroid is acting up. It also might mean we would be thinking about, do you have any vitamin deficiencies? And lastly, look at how you bleed. Are you getting no periods at all? Remember what I said about your cycles being a vital sign. So, if you're taking hormonal contraception, then not getting your period can be expected. But if you're not on any contraception and you're not getting a period, or if they're irregular, and by irregular, I mean less than 21 days in a cycle, or they're longer than 35 days, this is when we should be checking for signs of a hormonal imbalance or out of range hormones. I just want to briefly go through some common conditions that are affected by our hormones. At Fertility, we can help with all three of these conditions if you're concerned that any of them are relevant to you. So the first condition is PMOS, formerly known as PCOS. It's now called polyendocrine metabolic ovarian syndrome, and it's a condition that affects roughly 1 in 8 people, so is really common. And the symptoms can include irregular cycles, excessive body or facial hair, acne, struggling to lose weight, hair thinning, and dark skin patches. The relevant hormones here are your AMH, which hasn't been discussed in this session. Your AMH gives us an indication about your egg reserve and is something that we do test if you do the fertility test. Your LH, which is the hormone that causes ovulation, and testosterone, and your androgen hormones. That's your testosterone and the related hormones. So if you have PMOS, one or more of these hormones can be high. LH can contribute to irregular cycles, and to be honest, testosterone can be a culprit of all of the above. It's diagnosed by something called the Rotterdam criteria. There are 3 elements, and you have to meet at least 2 out of 3 of the criteria to be diagnosed. So the first criteria is polycystic ovaries. Now, polycystic ovaries is a very misleading name and is part of the reason why PCOS, the name was changed in the first place, because polycystic ovaries will, of course, make people think that they have cysts on their ovaries, and it isn't the case at all. If you were to have a pelvic ultrasound scan, which is often needed to diagnose PMOS, they will be looking at your ovaries and they'll be looking at these follicles that I was discussing earlier, which are the eggs in their sacs. When you have polycystic ovaries, you have loads of these follicles that are visible in your ovaries. And once it meets a certain threshold, a certain number, that's when they're being referred to as being polycystic. So that's one criteria. The second criteria is irregular cycles, so outside the 21 to 35 day mark, and then out of range androgen hormones, which is your testosterone and associated hormones, or you have relevant symptoms. So the main ways that PMOS is kept under control is diet, lifestyle, and supplementation. So the Mediterranean style diet is the best diet for general hormone health and fertility. And for PMOS, it would be to also incorporate low GI foods into that Mediterranean diet. And low GI foods are foods that are considered to just keep people fuller for longer. Regular exercise is very important, but it's very personal to each person with PMOS. It can be a bit of trial and error. Some people will really benefit from higher impact exercise, others from low. So it can be a bit, like I said, trial and error on finding the best one for you. And then a supplement, a natural vitamin, vitamin B8, is commonly used for women with PMOS to help. It's been shown to reduce LH and reduce testosterone, which can help regulate cycles and help with symptoms. Now, just to say as well, this session is being recorded, so you can refer back to my recommendations at any other time. If you were doing all of those things already and your cycles still weren't regular or your hormones were still out of range, then medication can be provided by a doctor or a gynecologist. And when someone with PMOS has irregular cycles, ovulation is affected, and that's when it can affect fertility. Then we have endometriosis, which is where, for a top line summary, the same tissue as the lining of your womb, your endometrium, which sheds every month, it grows elsewhere in your pelvis and your body. It's a condition that is affected by hormones, but one doesn't cause your hormones to be out of range, and also it isn't out of range hormones that are causing it. The hormones that control your period, which we've been discussing, we're now aware that there is a large amount of fluctuation in these hormones throughout the month as required, and endometriosis responds to these fluctuations. It wants to shed itself because it is the same tissue as your endometrium, but because it's in the wrong place, it can't do that and then can cause lots of pain. And that's why the main symptoms you can see here is generally pain, and also you can have heavy periods. Again, it's common, it affects 1 in 10 people. Unfortunately, it is notoriously hard to diagnose because the first step is always a pelvic ultrasound scan, but it's common for nothing to be seen on a scan. So at this point, a lot of people can be wrongly dismissed. It then may require further and more detailed investigations, such as MRI and potentially surgery, to diagnose it. It can be helped, i.e., the pain can be improved by having an anti-inflammatory diet, more holistic things such as acupuncture people have. You can then be offered hormonal contraception and potentially surgery as well. Now, many people with endometriosis complete their family with no issue, but endometriosis can cause a less than ideal environment for where that fertilized egg wants to implant itself. It can also cause scar tissue, which can lead to blockages on the egg's journey from the ovary to the uterus, therefore affecting fertility. The last condition I want to discuss is PMDD, which is premenstrual dysphoric disorder, which is an extreme form of PMS. So 90% of people will experience PMS, and about 3 to 8% of people will then experience PMDD. It's associated with severe mood swings, brain fog, a loss of interest in usual activities, hopelessness, difficulty concentrating, sleep disturbances, and irrational thinking. So those symptoms are pretty significant. Again, the same as endometriosis, it's not caused from out of range hormones. It's that people who are susceptible to PMDD are just far more sensitive to the natural fluctuations that occur in the hormones controlling our cycle, namely estrogen and progesterone. Now, the current prescribed treatments from a gynecologist are hormonal contraception and or antidepressants as appropriate. But more natural ways to aid symptoms are Generally prioritizing self-care when you're at the time of the month where you are struggling the most, really taking care of yourself. Some people say just having a diagnosis of PMDD makes them feel better because they feel validated. There are lots of support groups online where people discuss maybe more natural ways that they have eased their symptoms, and some work for some work for others. An anti-inflammatory diet again can help here, and then supplements such as Agnus castus, L-theanine, magnesium, calcium, and vitamin D have been shown to help. Now, PMDD does not affect fertility. However, those symptoms are significant. So if you do feel like this is relevant for you, please refer to these resources. And you can, again, like I said, you can refer back to this session if you do feel like you need any further help. So part two, we're just going to look at how your hormones can affect your productivity at work. So quickly, just to recap, women have a monthly cycle. During the first half, the follicular phase, rising estrogen levels naturally boost energy and physical stamina, which makes it an ideal time for ambitious planning and tackling new projects. The second half, the luteal phase, is a time when energy might be lower and you feel like reflecting or scaling back social engagements to allow yourself to take it easy. Men, on the other hand, have a 24-hour cycle. They have higher levels of testosterone in the morning and lower levels in the evening. Therefore, the workplace was not designed with women in mind, and we're here to change that. So, if you want to optimize your hormonal health to benefit you at work, here are some top tips. For anyone who has female reproductive organs, get creative near the midpoint of your cycle. So, the end of the first half, when you're about to ovulate, that's when your estrogen is at its highest and you should be feeling confident. This is also a good time to schedule some important meetings. So, your appraisal, for example, because you'll feel good and be in a better position to advocate for yourself. The second half of your cycle can be used to reflect and recharge. And lastly, and this is just not just for the workplace, we're all different. So it's important that you track your cycle and your symptoms so that you can identify patterns that are unique to you and make them work for you. Understand when to expect your best days and your hardest days because they'll be different to your friends, your family, your colleagues. For anyone with male hormone cycles, this takes place over 24 hours. So when testosterone levels are higher in the morning, use this as your time for completing big tasks. You're more likely to feel confident and have more energy. And leave your easier tasks till later in the day. Use this time to recharge, reflect on the day. You should be calmer and your energy levels will dip. But similarly, you'd benefit from taking note of your highs and lows throughout the day and seeing if you can identify any patterns. So to finish, by tracking your cycle, we can understand how to optimize your daily life to your cycle. You can gain insights into your overall health, and it can be used as a method of contraception or to help conception. And by testing your hormones, you are being proactive into understanding your body and your hormonal health. You can get a diagnosis and clinical guidance if something is wrong, and leverage actionable insights to improve your health and well-being. So just to quickly go through the fertility test, what the test can tell you, we will assess your egg reserve and warning signs of any infertility. We can get to the bottom of hormonal imbalances or any out of range hormones, and we can screen for up to 18 health conditions. So if you've never done the test before, you'll be asked to complete a comprehensive online health assessment, asking lots of questions about you, your cycle, your lifestyle, any symptoms you might experience. And then we will curate a personalised hormone panel for you. That gets sent out as an at-home blood test where it's a finger prick test. You will then send it off, and within about 6 to 10 days, you will receive a written report from one of our gynecologists. We then have lots of other clinical services that will be offered to you and recommended in next steps as necessary. So that's it. We now have time for questions. Okay. Thank you. Sorry. I'm seeing some messages from earlier that we can hear you. Great. I'm glad I haven't been talking to myself for 35 minutes. Okay, so uh, the first question I've got here is how can fertility help with managing PCOS, PMOS, especially with the irregular painful period symptoms I experience? I have been constantly advised by the NHS to try the coil, but would like to avoid this or any other form of contraception due to the side effects I experience. Completely valid. I get this a lot. Of hormonal contraception can be a valid treatment, but lots and lots of people, understandably, do not want to use it. And I hope maybe when I did my PMOS explanation that you got some tips there. But they are the main things that I would recommend for PMOS, which is the Mediterranean style diet with low GI foods, trialing and error, a trial and error type, different types of exercise to find what works best for you, and then that supplement, which is called inositol, which you can just get online. If you had been doing all of those things for maybe 3 to 6 months, still were having irregular cycles, still were struggling with symptoms and retested your hormones and they were still out of range, your a gynecologist or your doctor can then help you further with prescribed medication that isn't just hormonal contraception. So if you find that you are unfortunately maybe not getting help or enough help with from your GP, I would either see if there's anybody in your GP surgery that does have gynecology experience, as they might be able to have a bit more info, or be referred to a gynecologist to help you further. But um, please don't feel like hormonal contraception is the only answer. It absolutely is not. Is it possible to have PCOS and PMDD? Yes, it is. I'm afraid to say you could have all of them, to be honest. And that's because PMOS is definitely related to those certain hormones. PMDD is that more sensitivity to your cycling hormones. So yes, it is. It is possible to have both, I'm afraid. Can you take hormones for relief of PMDD? So HRT, if you are not menopausal, HRT is going to be hormonal contraception, really. They're the same. HRT and hormonal contraception are the same thing, the same hormones of estrogen and progesterone, but they're just different doses. So hormonal contraception is a prescribed treatment for PMDD. So yes, essentially the answer is yes, there you can. Now, PMDD can only be diagnosed by a gynecologist. So it'd be best to speak to a gynecologist to get the correct dose of medication for you. So what would be, next question, what would be the best point in one cycle to test hormones? So sorry if I didn't say it before, but we ask everybody to do the test on day 3 of their cycle. If you're on hormonal contraception, it doesn't matter. But the reference ranges that we have for the cycling hormones, the hormones I've been talking about in this session, the reference range we use is for when you're on day 3. If you do it on a different day of your cycle, we do expect to see quite different results. Can we find out more about adenomyosis and what to eat to heal that? Also, can a person get pregnant with it and hold a pregnancy throughout? Yes, the answer is yes. With adenomyosis, you can. Adenomyosis is something that is becoming a more common finding, and it's not because the amount what's the right word? The rate of adenomyosis is rising. It's just because pelvic ultrasound scanners are becoming more able to see more, and that's why we're seeing it a lot more. Unfortunately for adenomyosis, it's where the uterine lining is growing into the muscle of your uterus. And unfortunately, there isn't enough known about it yet, and the only treatment is quite severe and it's a hysterectomy. So again, it would be the more natural ways of helping endometriosis in terms of an anti-inflammatory diet and a more holistic medication to help with that. I'm assuming in this situation, being asking if a person can get pregnant with it, you wouldn't want to be going on hormonal contraception, which is totally fair enough. But yes, absolutely, a person can get pregnant and hold a pregnancy throughout. If for someone who has already been trying to conceive, again, I would recommend speaking to an expert. That can even be going to a fertility clinic. Doesn't mean you necessarily need fertility treatment. But and at Fertility, we can absolutely speak with you to help you further. I hope that helps. Hi, thanks for the talk. You're absolutely welcome. Could you briefly go into more detail about the thyroid hormones and the menstrual cycle? My friend and I were in conversation recently about hyperthyroidism, and I was wondering how that affects day-to-day life as well as the menstrual cycle. Thanks. Okay, so with thyroid, you've got hypothyroidism, which is an underactive thyroid, and hyperthyroidism, which is an overactive thyroid. Now, we always test your thyroid hormones at Fertility. If you have a thyroid condition, and I have to say, being a nurse, my knowledge is probably limited, but if you are having a regular cycle, fine. We It can affect the menstrual cycle, it can affect and can cause irregular cycles, but not in all cases. And generally, then the way that it is found is from the symptoms that you can experience. I have to say, an underactive thyroid is far more common than an overactive thyroid, and generally, the underactive thyroid symptoms are um, fatigue, brain fog, feeling cold often, struggling to lose weight, and hair thinning. When it comes to fertility, if the thyroid is out of range, it can one cause irregular cycles, which can affect fertility because it's affecting ovulation, it's delaying ovulation. When you're trying to conceive, ideally, we'd like one of the hormones that we test with your thyroid to be it's a hormone called your TSH. A normal result is anything up to 4.2. When you're trying to conceive, we'd ideally like it to be below 2.5. Now, in an overactive thyroid, your TSH is generally lower. It's on the low side. In an underactive thyroid, the TSH is higher. And what that can mean is that you would need to take medication to get it under control. And once things are under control, it should not pose an issue. I hope that helps. Again, all of these questions, if you do feel like you want more and more of a personalized answer, then when you buy the fertility test, you will automatically be given a 30-minute consultation with somebody like me, and we can go through it more. So thank you. This was really helpful and interesting. Thank you very much. I wonder if you recommend people should do the fertility test before family planning, like when we are younger, or if this should be done only when we are ready to take action. Absolutely should be done at any time. So the types of people that we get doing the fertility test are people planning for the future, whether that's 5 to 7 years away. Then people who are trying to conceive, people who are experiencing symptoms. So yes, absolutely. You're going to get insight to your body. You're going to find out about you, your hormone health, and it will also give you an indication of your egg reserve. So then can give you answers on whether the plan that you have for the future actually is supported by your hormones because your egg reserve is looking very healthy, and also your age reflects where we would think the quality of your eggs would be. And it can also then help in cases of where it's quite a shock and unfortunately that egg reserve comes back as lower, that opportunity for you is not missed, even if that might mean that you need to change your plans slightly. So yes, absolutely, it's absolutely relevant for anybody and everybody. Why fertility over NHS? Good question. With the NHS, they will only test these hormones for you, and especially your AMH hormone, which is the hormone that gives us an indication of your egg reserve, only after you have been trying to conceive for 12 months. You can get your cycling hormones tested and your thyroid tested if you are experiencing symptoms, but it's not always something that is readily available. So with fertility, you're getting it all in one. Now, with the NHS, if you do reach 12 months of trying to conceive and you do go for fertility investigations, the fertility test is basically covering the majority of the investigations that the NHS would do. So it just gives you that opportunity, if you are already trying to conceive, to find out if there's anything going on prior to that 12-month mark. My cycle is 24 or 25 days. Does that mean my progesterone levels are lower? Or what does a shorter cycle than average 28 mean? No, not at all. Does not mean your progesterone levels are lower at all. A cycle of 24 or 25 days is perfectly regular, and does not mean that there is anything awry with your hormones at all. Um, the only thing is that if it's a shorter cycle, I'd be expecting you to ovulate a bit earlier. So instead of thinking of day 12 to 16, or I guess that textbook day 14, I'd be thinking more day 10 to 14-ish. Equally, if for somebody who has a longer cycle of maybe 32 days, for example, I'd expect you to be ovulating maybe more like day 18 to 22. So this fact that your cycle is a bit shorter, absolutely fine, nothing to worry about. Okay, I have endometriosis and adenomyosis, not had a histo, just endometriosis removal. I had surgery in 2023, and after 3 years, I'm feeling so much better. Great to hear it. I'm trying to conceive and I'm age 41 now. I was told to take progesterone or coil to slow down my endometriosis, but I haven't as trying to conceive. I feel like all seems well, but I'm still not pregnant. Should I do any tests or get support, or continue calmly on my journey? Now, I'm so glad that you're feeling better. That unfortunately isn't the case for everybody. So the fact that you are is great. Um, and obviously you're not going to be having the coil, because you're trying to conceive. It depends on how long you have been trying for. Now, when you're over the age of 35, if you've been trying for 6 months or more, that would be the time to where it's recommended to consider fertility investigations, which would be the fertility hormone test, just to check in, see what's going on. And then at that point, it would be a case of absolutely you could continue calmly on your journey. Or if you wanted to, if you're at a point where you felt that you needed help, that can be when you're referred to a fertility clinic. So, it would be up to you. But yes, technically, if you've reached 6 months of trying, then it would be recommended for you to have investigations. But like I said earlier, the fertility test is for everyone and anyone. So no matter where you are in your journey, absolutely feel free to do the fertility test and just generally find out more about you. So I took a hormonal test in 2023. Is it worth retesting? I was referred to a gynecologist for my PCOS through the NHS, and it still had the same outcome of needing to take hormonal contraception. So just wondering what I'm doing wrong. I've had mixed results with exercise and diet. Yes, so the blood results remain valid for about 6 to 12 months. So these would your results from before would be technically out of date now. They've expired. So if you do want to check in again, absolutely, we would recommend that. Generally, we recommend doing the test yearly, because things change. Um, so it can just be that you might need more specialized advice and tailored advice to you, whether that's speaking to, again, someone like me, and we can go further into your personal history and giving recommendations. The recommendations that I've said about PMOS in general is exactly what is recommended. And for then, if you need more advice on a tailored diet, then we have nutritionists as well, which is definitely something that is recommended for women with PMOS. So yeah, absolutely, I would consider it. And like I said before, hormonal contraception, it is very valid, but it is not the only option here. Okay, can one know how long a person has had an adenomyosis, and can it be caused by using contraception in the past? As far as I'm aware, no, it's not caused by using hormonal contraception. I've never heard that before, I have to say. And it would be very difficult to know how long you've had an adenomyosis for, because, like I said, up until now, it's only rising because of more detailed technology. Um, and it would before, it's then based on symptoms. So if you've had symptoms for a long time, then generally it would mean that it is something that has always been occurring. But as I said, I am not aware that using contraception in the past, and I would want to say no anyway. Like I said, we are going to be writing a blog after this session, to answer any questions we haven't answered, and I can specifically ask for that to be in there just to absolutely triple check facts. And how much does the test cost? So the test costs £250. And like I said, that also does include a 30-minute consultation with a fertility advisor. Do the finger prick test, only take a few drops of blood like a diabetic sugar test, or more like the arm prick test that take more. I have a phobia of blood needles here, bit of a fainter, oh bless you, at the GP. So want to make sure it's the right option for me. Yeah, absolutely fine. It is more than a diabetic sugar test. That's when you just need a couple of drops of blood and you put it on the little film. This is a small vial, so it would need probably a good 8 to 12 drops of blood. We do have an option of an add-on service where a nurse can come to your house and take the blood for you. We also, with our customer service, they offer complimentary calls to support you through taking the test, which has really helped people. It can help you prepare before, making sure that you have a great blood flow, which is going to get the best results, and they can then talk you through whilst you're doing the test. We do have lots of needle phobic people who do manage to do it, so I absolutely have faith that you would be able to do it. Um, okay, why might we sometimes have a randomly long cycle or skipped period if we have otherwise normal cycles? Is that hormone based, and what's the science behind that random event? So these hormones, like I said before, they're very sensitive. Anything can kind of skew it. And actually, a very healthy person with is having regular cycles can have the cycling hormones go slightly out of range, whether it's low or high, and then come back into range as well. And generally, when you have a weird one-off period that's completely irregular, generally it will be that we would watch and wait for the next one and see if it was just a one-off. So anything can kind of set it off, really. Sleep deprivation, stress, a long haul flight, if you swim in a pool a lot. So it's of course good to check in if you were worried. But generally, if you had one completely odd period and then for the next 6 months your periods have been fine, it can just be a one-off of we were essentially having an off day, basically. And the hormones are very resilient. As sensitive they are also very resilient and can easily come back into range. Now, if you do the fertility test, we find that, for example, your cycling hormones are out of range, which are the ones that control your period, but you're having a regular period. It can just be slight lifestyle adjustments, a slight change in diets, taking some things out, putting some things in, for example, or the type of exercise that you're doing, that can completely sort it out. And then you carry on like normal. What are the hormones people jab themselves with in IVF, and does fertility offer help to trans people who menstruate? Yes, absolutely. Obviously, that is a very personal journey, and we would want to tailor your journey to you. So the answer is yes, absolutely, we can help. Now, the hormones that people jab themselves with in IVF is generally the follicle stimulating hormone that I was talking about at the beginning. So the follicle stimulating hormone naturally is released by the brain and tells the ovaries to start their job for the month, which is to grow follicles. Now, when you're taking the hormones in IVF, you're giving yourself more follicle stimulating hormone, which in turn is the aim is to then grow more eggs than that natural one that would ovulate. That's the purpose of IVF. We are trying to get as many eggs and hopefully good quality eggs as we can. And that's what those injections will help with. There are a couple of other injections that you take during IVF, which one you would start taking to make sure that those eggs that we're trying to grow don't ovulate accidentally early so that we wouldn't be able to collect them. And then you would also take one more injection that causes the eggs to mature. And that's generally taken about 2 days before you would have the eggs collected. Okay, I've got to the bottom of the list. Any more questions? We've still got 10 minutes. Also can appreciate that this is, a very personal, emotional subject. If you felt like you did not want to ask any questions now, completely fair enough. You're more than welcome to email us at customer service. I think on the next page of my presentation, I have got how you can get into contact. So please take that down if you have any more questions. Okay, so the there's another question. Are the tests just looking at fertility? My fatigue has been always been more than others during my period, but since I had a child, it's increased fatigue on the first 3 days so much without any GP explanation. Could this give me answers, or would looking at diet, lifestyle, etc. be better? It's not just looking at fertility. So the main sort of things that we're looking at is your egg reserve, the hormones that control your period, um, then your androgen hormones, which is testosterone and the associated hormones, and then your thyroid. I have to say, not everyone gets the complete full panel. Some of the hormones, like your androgen hormones, are only included if you are experiencing particular symptoms. But with fatigue, if you did the test and so for fatigue, we'd firstly think about your thyroid. If your thyroid was fine, then the next thing we would be thinking about potentially is any vitamin deficiencies. I have to say, Fertility doesn't currently test for vitamins. It's definitely something that's coming this year. But that would be when we would be referring you back either to your GP to look at vitamins. Now, vitamins deficiencies are very, very common. They can make you feel rubbish. So it's definitely great to kind of try and get a bit of an MOT and looking at multiple vitamins that can absolutely make you feel that way. Now, one vitamin in particular that's commonly known to cause fatigue is iron, and we have two not types of iron, but two ways iron can be tested. So we have the iron that is flowing in our blood. That is a general one that's very commonly tested. We also then have iron stores, which is called your ferritin. Now, generally, as women, we are just at a disadvantage because we have periods. And for people who have heavy periods, you obviously are losing more blood than the next average person. So, for example, men can have ferritin levels sitting at about 70, and women can have ferritins as low as 15. So it's then absolutely no wonder we're tired all the time. So that's absolutely something to consider next if your thyroid was working normally. And yes, that would then be helped with diet and supplements as needed. And that's something that either your doctor or a nutritionist can help with. Would you kindly explain more about adenomyosis for a layman, please? So, your endometrium is your uterine lining, which sheds every month. It sits in your uterus, and for someone who wouldn't have adenomyosis or endometriosis, that lining would be completely shed. It would be very, very thin when your period has ended, and then it will build itself up again prior to ovulation when it's going to be at its thickest. Now, the in adenomyosis, it's when that lining is growing down into the muscle of the uterus. And again, it's kind of similar with endometriosis, is that then naturally that tissue wants to shed itself, but it's embedded itself in the muscle of the uterus, so it can't shed itself, and that causes a lot of pain. That's the top line summary. That is generally what adenomyosis is. Okay. Any more questions? No. Fab. Okay. Absolutely welcome. I hope that you have learned at least one thing from this session. And like I said, we are recording it. So, oh, one more question has come through. So, do you test more than a GP panel? So in terms of fertility investigations, if you were approaching your GP at the 12-month mark or 6-month mark, depending on how old you are, then the what fertility tests is basically everything that the GP is going to test. The only hormone that fertility does not test is your progesterone. And that is because, as we discussed in the session, your progesterone really is only relevant in the second half of your cycle. And because we ask you to test on day 3, your progesterone is naturally very low at that time. So there's just no point testing it. So that's the only other hormone that a GP would test if you were going, if you're trying to conceive. If you're somebody that is just generally wanting to find out about their health, then fertility is going to offer far more than a GP can, yes. Okay, do people of age 37, for example, with a longer cycle, longer than 28 days, have more egg reserve than people with a cycle of 21 to 28 days? Or does the cycle length not affect egg reserve? No, it had those two are not relevant. Um, yeah, basically the answer is no. Um, as long as it's between 21 and 35 days, everyone is just different. Some people are longer, and that's okay. And all it means is that the ovulation is going to occur at slightly different times in the cycle, but having a regular cycle 99% of the time confirms that you are ovulating. So it doesn't then necessarily mean that you're retaining your egg reserve more. Um, Everyone is born with their eggs. Some people are born with more, some people retain them for longer, but your cycle length doesn't reflect your egg reserve. That would be the AMH hormone that we test. Okay, fab. All right. Well, like I said, if you have any more questions, please feel free to email us and refer to the contact details that are on the screen. Otherwise, I hope I've helped and have a lovely evening, everyone. Take care. Bye bye.